Non-surgical lifting treatments of the upper face. Hi, my name's Doctor Sanjay of Trick One Aesthetics Mayfair. In this video, I'm going to be talking through 3 of the most common treatments we do that all essentially work towards lifting from the upper third of the face. The 3 treatments are going to be anti-wrinkle injections or a Botox brow lift. It's going to be a temple restoration or temple filler using dermal fillers. And it's going to be the Sculptra ponytail lift or the ponytail lift using Sculptra. So firstly, talking about the Botox brow lift, this is probably going to be one of the more famous or popular or quick and easy ones, and that's because as a treatment, it's a very simple treatment to do. It's just going to be a couple of really small injections within the brows that essentially are targeting your muscles, and by relaxing certain muscles in certain specific ways, there's a pull that happens by the opposite muscle which can create a lift. So the muscle that is around our eyes, if we shut our eyes tightly, it pulls everything in. When we relax this muscle in a certain way, the muscle that lifts, that raises your brows up, takes over. That's the way that we can use anti-wrinkle injections to manipulate muscles to create a bit of a lift. Now, depending on your starting anatomy, we can actually use this quite effectively to create a little bit of a lift from either the tail of the brow, or the arch of the brow, or a combination of the two. The pros of this treatment are it's really quick, and the result typically is going to be within about 2 weeks or so. It's not very painful, there's not much downtime, it's quite a straightforward procedure to receive. Obviously you're going to have to go through all the risks properly in detail via a consultation, but the ultimate risks of this procedure are going to be very low compared to other procedures. So it's a little bit like low risk, low reward as a treatment, and there's not too much you need to worry about. Obviously, the symmetry of your brows needs to be balanced out, your muscles need to be analysed, and everything needs to be done properly, but overall it's not going to be as stressful a treatment as other options potentially. The next option that we're going to be focusing on is going to be more like a temple restoration using dermal filler. So this type of patient might be a little bit different. They might be someone who's a little bit older and they've lost some volume within their actual structure of the face. So the temple region, which is this entire region here, is one of the regions that actually loses volume over time because the bone actually goes in. So whenever we talk about non-surgical treatments, a lot of people will say something like, oh, I don't ever want to do a dermal filler treatment. I get it, I understand, because when you look around you, you can see scary things associated with dermal fillers, unnatural looking results and all sorts of enhancements gone wrong and botched and all of these things. I can see why it's quite scary. But then you've got the other side of the industry, which is going to be the side of natural look restoration treatments, where in effect it's using high quality dermal fillers which integrate beautifully and last a really long time to restore an area that's lost volume, not enhance, so you're not looking to create anything new. And in the case of a temple restoration, if we restore this area here, what actually happens is when we lose the volume, the brows start to collapse, we start to get excess skin building up above the eye, and people can look a little bit tired from above their eye. So this treatment is super common, because if I've got a patient who's, let's say, in their 30s or 40s, they've never had a treatment before, they're coming to the clinic for the first time, one of the most common indications will be, I feel like I look tired. For this type of patient, part of the reason why they're looking tired or they feel like they look tired is to do with their brow collapsing and heaviness from above their eye. Temple filler or a temple restoration treatment is quick, it's effective, it lasts a long time. So this one lasts more like 12 to 18 months compared to 3 to 4 for anti-wrinkle injections. So the longevity is very good. And again, it's not very painful to receive. The downtime is pretty brief, pretty short as well. And if done safely, it's a safe treatment. I always need to caveat that with dermal filler injections because, like anything in life, if things are done inappropriately, it can be scary. If you have too much water, you can drown, for example. With dermal filler treatments, they can either be high risk if done in a risky way or low risk if done safely. The final treatment of the 3 is going to be Sculptra. Now this can also be known as the ponytail lift or the mini lift, and with this treatment, this is a biostimulator, and we actually treat the entire region around here and go up into the hairline. So this treatment stimulates the most collagen and elastin and probably has the most lifting capacity out of the 3 treatments. With a Sculptra treatment, Usually it's going to be a course of treatments, so maybe 2 to 3 treatments over a period of time, about 1 month to 6 weeks in between. So with this one, it's not going to be as immediate as the other treatments we've discussed, but the lifting potential is a lot more. With this one, the risks again are minimal if done safely. The downtime typically isn't too bad. It might just be a little bit of swelling for a couple of days, which settles down quite swiftly, and the results last ages. It can last over 2 years in many cases. So with this type of treatment, we're treating not just the temple area here, but we're actually extending into the hairline, and then there's so much stimulation of collagen, it can really lift up the entire region. So to summarise, we've discussed 3 non-surgical lifting options for the upper third of the face. All 3 of them can be great options in the right patient. It really depends on the time frame, what they're trying to see, their starting anatomy, and the overall result that we're trying to achieve together. So the most important thing is to have a nice detailed consultation where someone can look at your anatomy and pick with you what the best option for you will be. I hope you found it educational and informative. If you've got any questions about any of these lifts, please do drop a question down below and we'll get back to you. Thank you very much.